introduction. Meet Cornelia. Cornelia's background consists of her being a 5-year-old little girl. She's in kindergarten. She lives with her mother and father. She has one sibling named John, and Cornelia has no health concerns. However, Cornelia does have developmental delays in some subjects. She is a very happy little girl. She enjoys music, Elsa, dancing and playing and making friends. Her favorite character is Elsa. Cornelia's academic and behavior history begins with some of her developmental delayed concerns. As a little girl, she has troubles with counting an array of objects up to 5. Also, she's unable to cognitively learn and answer questions during reading group or with a large group of peers or on different assignments. She also has some difficulties with her fine motor skills where she takes on occupational therapy and speech therapy. And so music helps her with those developments, as well as she has trouble copying letters of a name in a classroom setting. She is learning to work on pre-numeracy skills, cardinal, and counting up to numbers 1 through 20. She does use manipulatives like 10 frames and multi-link cubes and other mathematical objects in the classroom. An observation of Cornelia in multi-settings takes place in the cafeteria, the classroom, and the classroom setting starts with a peer assistance with getting materials. Also, she is easily distracted and redirection, as well as she receives pullouts for some of the services that she receives, such as occupational therapy, music therapy, as well as speech therapy with some of the extra related services she needs towards her IEP to help her in a classroom, as well as she needs that one-on-one instruction for that remedial assistance. Also, she works very well when she has extra time to complete an activity. In the cafeteria setting, Cornelia has a peer assistant who helps her get her meals so she can carry her tray, and as well as help her with the etiquettes of opening her milk and juice. She has cafeteria functional skills like feeding herself and selecting the different types of food she likes, as well as cleaning up and performing the cafeteria duties without support. Now, on the playground, Cornelia is very energetic and she smiles and laughs with others. She has no physical limitations and she enjoys that social interaction with peers. Some of her social strengths and challenges: she likes to play, learn, and grow, and caring is something that she is very compassionate about. She does care about others in the classroom. She works well in cooperative groups, only a very limited number of boys and girls, no more than 4 or 6 students. She selects her friendships based on the smartest student, and that particular student is her peer assistant person in their classroom. She also picks a person that she mimics proper and inappropriate behaviors. That's all about her social skills when it comes to her behavior. She enjoys playing with boys rather than girls, maybe because she has a brother of her own, and making friends to her is very easy. It comes naturally. She enjoys joking and playing, and she laughs very well with her social skills. Some of her challenges, again, we mentioned earlier in the slide, was her fine motor skills, those things of able to count numerals 1 through 20. using those objects to help her understand some of the mechanics that she is lacking. Another challenge she has is staying in one area, working with more than 2 people. Sometimes that can be confusing to her, not being able to keep up with others, keeping her hands and feet to herself. Now, some effective interventions, we want to make sure that making the most of small group instruction helps her reteach some of the lessons that we taught, which was the life cycle of a ladybug, and she was able to know that using pictures of these particular parts, such as identifying what a ladybug begins with, starting with the eggs and then the larva and attaching to a leaf, and then traveling down to a pupa, then turning to a young adult, and then an adult stage of a ladybug. So she had to distinguish between different pictures to describe why animals had spots. Some different ways in the intervention, we allowed her to find different ways how to find objects, to find the number of sums. So she would use a 10 frame, and she'll also use a number of objects to match the number of objects that she has, so she had the right total. She does receive peer assistance and uses assistive technology to assist her with those fine motor skills. Proper verbal cues only are directed to Cornelia, so we have to sometimes prompt the cues so she'll be able to see what actually I want her to learn. Now, reflecting on what we have learned based from the small intervention, Cornelia works well with verbal and oral responses, very limited questioning. She needs that extra time to get an understanding of what I'm trying to ask her. So giving her that wait time helps us understand what she's able to learn and understand, and to analyze the question so she can answer out loud. Again, using those manipulatives, those 10 frame mats, and as well as matching the pictures in order so I know she understands. So pictures are very important. During the intervention, some things did not work very effectively. So one thing was using the 10 frames to rename a number of objects. She had difficulty because she only has a limited number of objects that she's able to count to, and that's 1 through 5, and we're trying to get her to get to that 1 through 10 and gradually to the 20 mark, according to her IEP. So matching the life cycle to the word was difficult. She can identify and tell you what the picture was in the life cycle of the ladybug, but she couldn't read the word and tell you that that word matched the picture of the life cycle. Practicing different combinations with the objects to make 10 was quite difficult for her. So in cooperative learning group, Cornelia had to do several different things that I thought that was very effective, and implemented those quite often. Was when students get together, they do the think, pair, and share. They're given a topic, and they're able to think and pair with a partner, so that works really well. And she was able to discuss with a partner about spring, coming from winter and then changing to a new season. So she also likes to take picture walks through the book, so she can also look at the pictures and describe what's happening in the story. She's able to make predictions prior to reading a read aloud, or she can prompt and answer those questions if you point to a particular picture. So all that planning and helping her identify those different types of pictures during a read aloud. There are some results that I noticed when working with Cornelia, that she is inattentive to large groups. She has trouble starting an assignment, so that allows her to get up after a few minutes and start roaming the classroom. She starts to interrupt other peers at her table, and as well as speaking while the teacher speaks. So all those important factors would help her if she would remain quiet and listen and sit still, so she can make those changes. Now, what I would do differently with Cornelia, since some of these effects of being inattentive in large groups, is try to only praise her more and give her those prompts to make her correctly answer to a question or something in a group. Also change the number of students that may be in a large group. So instead of having a full class of 19, maybe probably do it in groups of 6, and maybe after several different small interventions, she'll be able to get that concept with opportunities to learn. Now, the most important thing that I learned about this case study is that I've learned patience. We're working with students from smaller grades as well as students with different special learning disabilities. And with those developmental delayed students, it takes a lot of strategies and methods to make sure that they need those extra supports to identify one skill at a time and making sure to pace myself and to provide those simple instructions. So again, different instructions and methods allowed the student to be very effective in small group. The end.